Good afternoon. This is Dr. Bernadette Madrid, the moderator for the Manila Symposium on the Child Without Borders, Cultural Beliefs and Practices Affecting Child Protection. So we are now on the webinar Symposium D1 on developing community social service workers bottoms up. To inform our participants who are registered online, we have a live audience here in the city of Manila at the Convention Center who will be participating in this webinar live. And we also have a panel of reactors made up of Director Gemma Gabuya of the Policy Development and Planning Bureau of the Department of Social Welfare and Development, and Dr. Ines Danao, Professor of the Asian Social Institute, and Professor Ophelia Mendoza of the Philippine Women's University, also the Social Worker College. So I would like to welcome everyone on this webinar, which is a partnership between the Child Protection Network Foundation and the Global Social Service Workforce Alliance. This is the first time that this will be tried here in Manila, and I hope that this will be very successful because we're very excited about the use of this technology. Thank you. I move over to you, Jim. Our agenda for this symposium,
okay,
we're going to answer. Yeah. Go ahead, Jim.
Go ahead, Bernadette. Okay, I will go ahead here. Bernadette, I think your microphone is muted, so maybe you want to unmute it, and then you could go over the agenda, and then I would take the next slide.
Okay. Can you hear me now? Okay. So our agenda will be to answer several of the following questions. Who is the social service workforce? What are the guiding principles for the development of paraprofessional social service workers? What are the functions and competencies for these paraprofessionals? What are the examples of generic core functions and competencies? And how do we apply these functions and competencies to specific groups? And our speakers will be sharing promising practices and overcoming challenges and the way forward. After our two speakers, Nathan Links and Zeni Tumbadu, have done their lecture, we will open the floor for questions and answer for 10 minutes before the panel of reactors here in Manila will also weigh in on the topic. Over to you, Jim.
Thank you very much. It's a pleasure to be with you and to be with everyone online as well as everybody in the room, at least electronically. So we're going to start with who is the social service workforce. And I should say for a moment here, my name is Jim McCaffrey, and I am an expert in social service workforce strengthening and work with the Capacity Plus project, which is a global project aimed at health and social service workforce strengthening in Washington, D.C. and globally. I'm also the chair of the Global Social Service Workforce Alliance. So let's start with that basic question about who is the social service workforce. And we wanted to stress that there is a broad definition of the workforce, that it is a variety of workers, formal and informal, paid and unpaid, professional and paraprofessional, governmental and non-governmental, and that they are aimed certainly at making the social service system function and contributing to promoting the rights, ensuring the care, support, and protection of vulnerable children and families. And just so that we're all on the same wavelength with this, you know, while this workforce is grounded in core social work principles, it also includes not only social workers, but also other professional and volunteer cadres. It includes, for example, civil society, government and community actors, professional and paraprofessional, and so on. In particular, child protection officers, child and youth care workers, supervisors, managers, program planners, policymakers, and educators. It also considers to have an allied workforce, which includes people from other sectors, including education and justice. So it's a broad definition, and different actors play different roles depending on what's happening with the workforce. So that's the definition that we'll keep in mind. And in this particular session, we'll be focusing on, of course, paraprofessionals and community level workers. The Global Social Service Workforce Alliance, this is a slide which captures its vision, mission, and approach. And the vision is basically trying to work toward a world where well-planned, well-trained, and well-supported social service workforce effectively delivers promising practices that improve the lives of vulnerable populations. And our mission within the Alliance is to promote the knowledge and evidence, the political will, and the action needed to address key social service workforce challenges, especially within low to middle income countries. And those three boxes below the approach, one is we see ourselves as a convener and participating in fora like this and leading fora like this, that we're looking to advance the knowledge within the field of workforce strengthening by both supporting new research, disseminating new ideas, looking at best practices and so on, and that we're looking to advocate for workforce supportive policy reforms at both the global and national level. In terms of Alliance events, we had a global symposium in 2014. We did an electronic in May 2014 Social Service Workforce Week, where we looked at key workers in different countries and did case studies and shared that over a period of 5 days. And then we've done other events and co-organized or presented, including the CPC network. Whoops, that went automatically. There's a ghost in the system. Like in conferences in New Jersey, Senegal, India, Sweden, and DC. Sorry, my computer's moving things automatically here. We've done 17 webinars, and as I think Bernadette said at the beginning, we've done one other webinar that was combined with a live audience, but this is the first one that's been as extensive as this. And you can view the webinars in person and download them from our website and from YouTube. Whoops. Let me go back. So one of the things that we have done and organized is Alliance interest groups. And the purpose of interest groups is to bring together people from around the world that are particularly interested in hot topics and that wish to develop and address some of the challenges with respect to those topics. So we have two so far. One is an interest group on paraprofessionals in the social service workforce. That is a topic of great interest around extending the social service workforce to some of the areas that are more at the community level. And this interest group is looking at guiding principles for paraprofessionals and the competency framework for paraprofessionals. And you'll hear more about this, as that is the main focus of the immediate presentation. We also have an interest group on building the evidence base for strengthening the workforce. And we're looking at workforce indicators, a research matrix, and the development of performance indicators. And all this is aimed at is providing the sort of evidence base that can be used to both measure workforce strengthening progress and use it for advocacy in the future for the importance of the workforce and the importance of strengthening it. So that's a little bit about who the workforce is, or what the Global Social Service Workforce Alliance is, and what the two interest groups are. And so that's background. And with that, I'm going to turn it over to Nathan, who will begin the presentation on paraprofessionals in the social service workforce and the competencies. Nathan, over to you.
And I just want to come on board for a moment. This is Chris Horvath speaking, that we are working to address the issue with Nathan's microphone. So I'll beg your patience as we do that. As we wait just a moment, perhaps I could take this time to just ask everyone who's logged in as a participant to just enter your name, your organization, and the country where you're logging in from in the chat area. We would be very interested to know the range of organizations and places that are represented in our conversation today. So thank you. If you could do that, that would be great.
Okay, so we've heard about the Alliance, and we've heard about what is the social service workforce, and we've heard a little bit about the interest groups that are part of the Alliance. Today we're going to talk to you particularly about the paraprofessional interest group, but let's start by talking about what are paraprofessional social service workers. So in fact, there's not an internationally agreed upon definition of paraprofessional social service worker at either the global or regional level. And this is particularly true within the context of countries where the social service workforce is not highly developed and there's not a formal social welfare system. But there may be a range of different kinds of people working in direct service roles at the community level, and these are really the people who don't have professional credentials that we're talking about as paraprofessionals. They can be seen as people who work alongside professionals. They can be seen as people who work with supervision from professionals, or basically people who don't have a university or a certification that fully equips them in a legal sense or in a cultural sense to practice in that area. So that's what we mean by paraprofessionals. And there was great interest in this group as the Alliance got started. So this slide shows a little bit about the training of paraprofessionals. Training is a very important part of paraprofessionals because it's one way for them to understand their functions and also to get support and to begin to provide incentives to them and also ensure some accountability of what they're doing. The titles of what these folks are varies considerably from country to country or even internally within the country, but they're all people who work alongside human service or social service professionals and assist in providing care and support, and generally are focused on the community. Oftentimes they're volunteers, but as you'll see when we get to our principles, we have some thoughts about volunteers versus compensated or paid or incentivized paraprofessionals. They may work within governance structures. They also may work within civil society organizations. So that's what we mean by paraprofessionals. And this slide goes into a little bit more detail about some of the examples of the titles that might be used. Child and youth care workers, like auxiliary child and youth care workers, parasocial workers, has become an important part of the workforce and has been recognized to some extent in some programs such as PEPFAR, where it was listed as an indicator. In some areas, these specialty areas may not be present. And so paraprofessionals work may be called things like outreach or community workers. And even those terms may be credentialized in various places. So one of the struggles that we've gone through is what do we really mean by paraprofessionals and what do we call them? So as I was mentioning before, the Alliance early on identified that paraprofessionals were a priority area and something that many people were doing in many places in various ways, and something that we wanted to get together and figure out some ways of sharing and supporting each other. So we formed an interest group, and this was really the first interest group that the Alliance put together. It was initially convened last October, so we're just over a year old. And we have participants from various parts of the world. There are currently about 22 active participants and others who have consulted or assisted us as we've gone along. And our primary means of communicating, given that we're also spread out, is conference calls and emails. And we've had one opportunity for some of us to get together face-to-face. So that's how the interest group has been put together. When we first started, we decided to put out a survey for those who were interested to highlight what their interests were, why they were coming together. and what they thought were important issues. So the group saw advocacy, sharing experiences across countries, and also developing some competencies of paraprofessionals. And these competencies could be agreed upon and perhaps developed eventually into some kinds of standards or even universal definitions of how to best deploy paraprofessionals. So those were some of the initial concerns that we came up with within the group. The group then decided to develop a set of principles out of the survey responses for paraprofessional social service workers. And so those principles are one of the things we're going to be sharing today, as well as the competencies and implications for programs and training. So this figure will show some of the more specialized groups that are connected to particular fields of practice.
Again.
As I've just pointed out, there may be paraprofessionals working as part of the social service network or the social welfare system that are not identified with a particular group. But there are several groups that have come forward as we've been beginning to work together and have made the case that they really utilize paraprofessionals in what they do, and there may be specific needs, specific interests, and specific competencies and functions that relate to those. So here you see para or auxiliary child and youth care workers, which we're going to give you some detail about later on. Zenny will share her experience and what they've done in terms of refining these competencies further. And then we have parasocial workers that really may be working more on systems levels, but they also provide some direct work and support with vulnerable populations, whether they are children or other vulnerable groups. And the third group that we've highlighted so far are paraprofessional community development workers, which also intervene and work at the community level particularly, including economic empowerment, etc. But note the box at the top indicates that there's substantial overlap between these groups, particularly where there are multiple paraprofessionals serving these needs. So the challenge for our group was to come up with something that would be useful to everybody, but allow enough flexibility so individual groups and individual contexts could be borne out as we develop these functions and competencies. So we're going to, before we actually go into the principles, functions, and competencies, I'm going to give an example specifically about how paraprofessionals fill gaps for vulnerable children and families. And this is sort of my experience, but it sort of shows you how we brought this together. So in 2006, I was asked to go to Tanzania to develop a collaboration with a school of social work, the Institute of Social Work, to strengthen their programs and begin to encourage faculty to do more community-based training. And under the American International Health Alliance Twinning Center, we developed a partnership and began a series of exchanges and ways of strengthening each other's programs. And the hope was that we would help strengthen their programs, but they would also have a contribution to the School of Social Work that I was involved with at that point, the Jane Addams College of Social Work. And we worked with them, what their interests were, why they were coming together, and what they thought were important issues. So for those who were interested, to highlight what their interests were, why they were coming together, and functions that relate to those. So here you see para or auxiliary child and youth care workers, which we're going to give you some detail about later on. Zenny will share her experience and what they've done in terms of refining these competencies further. And then we have parasocial workers that really may be working more on systems levels, but they also provide some direct work and support with vulnerable populations, whether they are children or other vulnerable groups. And the third group that we've highlighted so far are paraprofessional community development workers, which also intervene and work at the community level particularly, including economic empowerment, etc. But note the box at the top indicates that there's substantial overlap between these groups, particularly where there are multiple paraprofessionals serving these needs. So the challenge for our group was to come up with something that would be useful to everybody, but allow enough flexibility so individual groups and individual contexts could be borne out as we develop these functions and competencies. So we're going to, before we actually go into the principles,
Then
functions,
we
and
have parasocial
competencies,
workers
I'm going to give an
that
example
really mean
specifically about how paraprofessionals fill gaps for vulnerable children and families. And this is sort of my experience, but it sort of shows you how we brought this together. So in 2006, I was asked to go to Tanzania to develop a collaboration with a school of social work, the Institute of Social Work, to strengthen their programs and begin to encourage faculty to do more community-based training. And under the American International Health Alliance Twinning Center, we developed a partnership and began a series of exchanges and ways of strengthening each other's programs. And the hope was that we would help strengthen their programs, but they would also have a contribution to the School of Social Work that I was involved with at that point, the Jane Addams College of Social Work. And we worked with the Department of Social Welfare, which is part of the Ministry of Health and Social Welfare. They had asked for assistance in training their social welfare officers in various ways, particularly around psychosocial approaches, HIV issues, and reporting and documentation. So beginning in March of 2007, we began to implement this program, and we had colleagues at USAID that came to our early programs and called for us to expand this program and find some ways of scaling it up. This program became called Parasocial Work, and it became incorporated into an ongoing system of training, support, and monitoring as a way of meeting workforce gaps and improved services. And initially it was a short, basically week-long program, then expanded to 2 weeks. And but as we worked with the program, we realized that we were actually beginning to recognize and support an emerging cadre within the workforce. And so we developed a program where people would come for 2 weeks for initial training, and we would also bring supervisors along. So these people were nominated and selected from their local level, and they came together in teams with parasocial workers and supervisors together. So the supervisors got additional training in addition to the first 2 weeks. Then they went out and worked in the community together, so the parasocial workers were working under supervision, and that was followed by coming back for an additional week of training, at which point they were dubbed parasocial workers. And you can see the numbers. We've trained almost 5,000 parasocial workers and supervisors at some level, and about half of those, or a little more than half of those, have completed the overall training program and are placed at the village or ward level. Now, the program was identified by PEPFAR as an indicator, as I had mentioned earlier, and it's been adapted and implemented in several other countries, including Nigeria, Ethiopia, and Zambia. So this story sort of highlights a number of issues related to the social service workforce and how paraprofessionals can be engaged to meet the needs of vulnerable populations, as well as begin to provide a career ladder for the system. And the career ladder is one of the important principles that we've begun to develop. We have an example here that the person may begin as a parasocial worker at the village level, and I've highlighted here already what kind of training they receive. But then we've also developed an additional program, a social welfare assistant. That's a person who's accredited to work at the government level. They hopefully come from the parasocial work group, and they work under the supervision of the social welfare officer. But this social welfare assistant also supervises parasocial workers, and that program has been implemented now for the last couple of years. And then the professional level is the social welfare officer, who may work at the district level or at the central level or at the ward level. And that person has an advanced diploma or a bachelor's in social work or the equivalent. So they have a number of other legal responsibilities, and they supervise the social welfare assistants. So now we'll turn over to Zenny.
Thank you. Thank you, Nathan. The interest group members right at the outset identified guiding principles for the development of para-professional social service workers. These principles represent a base for the development of programs and activities to train, develop, deploy, and support para-social service workers. And recognizing country-specific context, they promote the planning of the para-social service workforce, the development of the para-social service workforce, and support of the para-social service workforce. Workers. Just to go through the overview of the guiding principles, some of the overarching principles are noting that the recognition and respect for parasocial represent the base for the development of program check the private chat I sent you and activities to train, develop private chat. Go ahead. Not open. Ask him to find out. And the other thing. The recognition and respect of para-social service workers are underpinned by certification and policies that are relevant to different countries and different governments. It recognizes the strengths-based approach, where the wisdom, the assets, the knowledge of the individual, the family, and community are seen as potential resources. There must also be sensitivity to the local cultural traditions and ethical standards. When we looked at the principles relating to the planning of the workforce, it was said that there should be clear functions, roles, and skills for the different para-social service workers. Research should be undertaken demonstrating the impact of parasocial service workers. And employment opportunities should be created for parasocial service workers both at non-government and at government levels. There should be an access to a career ladder where the aspirations of workers to advance their careers and develop further should be supported and encouraged. The lattice approach will allow workers to shift focus laterally across different professions. So, for example, a parasocial service worker can choose to develop and become a child and youth care worker or a social worker if that was their career choice. We also said that core standardized and updated certificate training courses with very clear learning outcomes should be in place. There should also be opportunities for the continuous professional development of parasocial service workers, which will ensure that the attendance of conferences like the one that you are attending at the moment, short courses, and other learning opportunities are recognized, allowing parasocial service workers to refresh and update their knowledge and their skills. Some of the principles, again, continuing to relate to the development of the workforce, talk about the localized training and deployment of parasocial service workers. The localized training will ensure that parasocial services are found in communities that need them the most and that they remain in those communities. It is important to take an adult learning approach that will ensure that learning is participatory with a focus on problem solving skills, recognizing, of course, the expertise that exists within adult learners. We also felt that training must incorporate indigenous knowledges and approaches so that they fit in with local culture and national standards. When talking about the principles related to supporting the workforce, we felt that retaining localized social service workers so that they are as close to the children, the families, and communities they serve was critical. There should be appropriate salaries, incentives, and compensations offered to parasocial service workers. In terms of supervision and support, they need to have experienced workers with the appropriate training and background to provide them with the ongoing support and supervision specific to the area of their service. And lastly, when we talked about the caring support, we are recognizing that localized parasocial social service workers come from the very communities that they provide service in, and they too may be expected to have experienced similar issues and challenges that the very people they service would have experienced. So they should be giving ongoing support in a parallel process that actually contributes to their own development as well as their capacity to service others. Thank you, Nathan.
So once the group had gotten together and began to identify the principles, the next step was to think about how these could be utilized in practice and in training. So we agreed in our first actual conference call to try to work towards a set of competencies for paraprofessionals that would be useful in various settings throughout the world. So as we did this, we kind of went back and forth to find our way in terms of the best way to do this. Because, of course, all of this came out of our own experience and with our own focus in terms of the paraprofessionals we were working with. But we finally decided after we had worked on this for a while that we needed to have what we're calling general functions or generic functions or core functions that could be useful to all groups that are developing service programs and training programs for paraprofessionals working in the social service sector. And these would be useful to develop programs, but they would also need to be supplemented by functional areas and competencies related to the specific context, the culture, the specific discipline, or other issues that were occurring within that particular setting. Even the legal framework and certification framework would be involved as well. So they're generic in that they apply to most paraprofessional groups, but we don't expect all paraprofessionals to need all those competencies. So perhaps they're not really core functions and competencies. They're more of a menu that can be used in designing programs that deal with paraprofessionals. And of course, specific groups such as child and youth care workers or parasocial workers may have more specialized functions and competencies that can be combined with these in training and service programs. And Zenny will give you a pretty detailed example of how that's evolving within the South African context. So in terms of the functions, there are a number that have been developed, and here's a list of all of them, beginning with communication skills, working with children, youth, and families, and Of course, it's also important to note that these can be applied to other vulnerable populations such as elderly, disabled, people with addictions problems, etc. But the major focus of most of us who are working on this is children, youth, and families. And of course, children, youth, and families are present in all contexts anyway. Applies knowledge related to the client, community work, collaboration skills, organization and leadership, monitoring and evaluation activities, and some ways of developing self and others. So these are the generic core functions. And I'm going to give you some examples of some of them, but the actual competency document is lengthy. And if you would like to see that, then we can make arrangements as we develop this further for you to do so. So what follows is just a series of examples of these, but they'll give you a sense of the flow. So even the first one that I've listed here is communication skills, and the specific functions are skills needed to communicate with families and other workers in the unique cultural context, and ways to engage clients and family members in discussions about services. And of course, how to communicate directly with children or with vulnerable groups. So you can see that in terms of the actual competencies, we bolded some of the key points here. One of them is to show cultural competency through the correct use of language, body language, greetings, understanding the ethical values and cultural practices that relate to communication, and gathering, conveying, and receiving information, listening skills. And those are the practice competencies that would be part of what we would expect the paraprofessionals to do within their particular context. But you'll also see on the right there are paraprofessional training competencies that could be used to develop training programs to actually teach these competencies. And that includes things like ethical values at the community level, clear and concise written and verbal communication skills, use of child-friendly communication methods. So I'll go on to the next one, which is a continuation of the communication skills. You can see the focus here is much more on focusing on communication specifically with children and how to identify relevant information that's necessary for communication. Okay, so another one of the function areas is working with children, youth, and families. And this particular one, there are a number within there, but this particular one has to do with facilitating psychosocial assessment of needs and strengths of clients and families in a number of areas. And in terms of the practice competencies, one of the things that we're asking them to do is to follow approved assessment protocols to identify household or individual assets and strengths, identify what the concerns are, to develop a problem list and prioritizing it, and using basic recording forms. And you can see that there also are training competencies listed there that go with these. Still following direct work with youth and families and children is providing supportive counseling. So we developed some competencies related to that. One is just the ability to provide supportive counseling, and very important is identifying the need for consultation for supervisors and colleagues. So the belief is that paraprofessionals are able to practice up to their own expertise level and also what they're qualified to do, but they very often need to work with professionals, particularly around complicated issues around crisis, psychosocial needs, mental health needs, and the like. And so you can see the competencies that are listed there in terms of training have to do with empathy, understanding client feelings, motivating clients, and what issues they're able to do and which ones they're not able to do. So very often they need to refer to others for support or get support for themselves to provide the services that are needed when available. And we're very aware that availability of referrals and services varies from place to place, but that there are institutions present in almost any setting that people can tap into, whether these are formal services or one might be available through a health center, the police, or a church, for example, or mosque, or other kind of religious institution. So we teach the paraprofessionals how to obtain resources as needed. Okay, the next one in terms of direct work with children, youth, and families has to do with participating in developing a basic service plan. And you can see that this has to do with the ability to involve clients and families in decision making and help them to develop a service plan. And again, this requires support from supervisors and accountability, but there are some very specific training competencies listed here that has to do with identifying a problem list and figuring out resources in order to engage them and how the plan might be put into effect. So the last set of functions that I'm demonstrating here has to do with community work. And this is just one example of community work, but ensuring identifying services for children and families at risk of family violence, child abuse, or exploitation is one of the functional areas. And so here you'll see the practice competencies have to do with being able to assess community awareness of some of these issues and how to promote community awareness of some of these issues, as well as identifying community levels of risk. And there are training competencies that relate to each of these. How to raise community awareness of child protection interventions, how to advocate for individual clients and families, what are the legal protections, and what are country-specific policies with regard to gender-based violence, etc. And there's one more example of community work, which is working with community leaders and representatives of various groups. And there are competencies that have to do with developing community-level responses, implementing rights of children and other vulnerable groups, and participating in some community assessment activities with corresponding training competencies. So these are examples of the competencies that we've worked with. And now we're going to move on, and Zenny is going to give you a more specific example of how this work can be extended to a specific group, and then we'll talk about some of our next steps.
Thank you, Nathan. So what is child and youth care work? This definition by Jim Anglin notes that child and youth care work is work with children and youth as whole persons in order to promote their social competence and healthy development by participating in and using their day-to-day environments and life experiences and through the development of therapeutic relationships. Most importantly, the relationship with a particular child or youth is the focus of attention. So child and youth care work is based on day-to-day direct work with children and youth in the context of family and community. This is what we often call in child and youth care work, working in the life space of children and families. Child and youth care work is committed to the holistic growth and development of children and youth. That is at the core of child and youth care services. And when we talk about holistic development, we're talking about the physical, social, emotional, cognitive, and spiritual development of the young person. The core functions in child and youth care work include developmental care, and it's important to note the word care because care is at the heart of child and youth care services. Behavior management, where we understand that our responsibility is to care and support young people and children with troubled behavior as well. With developmental assessment, which is another core function, we're talking about the assessment of young people in order to develop an intentional and focused response and plan to their needs. When we talk about the development and management of planned environments, we're saying that even in your day-to-day life space work, it is important to understand that there are routines and patterns that create a predictable way in which people live their lives, and this gives the young children a sense of security. And of course, activity programming, where activities are planned for the development of young people. But of course, child and youth care work is relational work, and building therapeutic relationships with children and youth is at the heart of child care practice. The pictures I put out there demonstrate some of what I'm saying, but the picture in the middle with the child, the young person hugging her child care worker, shows the importance of connection and engagement with children and youth. So when we looked at child and youth care specialized functions, I'm going to just share two of them with you. One of our functions is, and one of our core functions is implementing life-space work. And here we say some of our functional areas are providing specific life-space work within routine interactions with children, youth, and their families to ensure that routines, developmental and basic therapeutic activities take place under the guidance of the supervisor. So if these are the functional areas, we're saying the competencies for child and youth care workers at para-professional level is based on ensuring the child's individual development plan is in place, allocating and adjusting routines, bath time routines, early morning routines, and tasks and activities so that they actually fit and suit the child and the family. And in this process, ensuring always that the developmental strengths and needs of the child is considered. Some of the training competencies that we are looking at would be the capacity to demonstrate an understanding that the life space constitutes the context within which all developmental and therapeutic work takes place in child and youth care work. And of course, the ability to explain what developmental and therapeutic value in life space work is all about. I think it's easier to demonstrate what I'm talking about in these pictures. This is an example of the therapeutic use of daily life events, an ordinary activity of cooking with children. Could be seen to be just, oh, well, we're cooking for children, but it's not the case. The child and youth care worker is teaching these young people to cook. She is demonstrating to them how they could cook food that is meaningful to them. This is a story of children living in a child-headed household in South Africa. The parents of these children, both of them, have died of HIV and AIDS. And the child care worker here is teaching them to cook food that was cooked by their mother when she was alive. And in this way, she is recreating and reclaiming memories. And in the process of an ordinary event of cooking, she's actually dealing with the emotional content and the emotional issues linked to this young person. The next picture is also a picture of two children whose parents have died, and their parents are buried, in fact, in the backyard of their home. The child care worker here is teaching them how to wash their clothes and wash their socks, because they need to be responsible when they come from school. But in this process of washing their clothes with them, the children sing, as they often do in South Africa, and they sing songs that were sung at the mother's funeral. And the girls start to cry, and they actually say that they miss their mother. And it is a moment for the child and youth care worker to hold them, to hug them, to engage with them. And this is a process of grief work that takes place in the moment. Child and youth care workers often talk about working in the moment and providing services to children as and when it is required. So grief work is not the 1 hour with the psychologist or the social worker. It is grief work that happens as children remember and feel hurt and concerned and in need of care. Another function of child and youth care workers would be to provide the basic daily and developmental care of children and youth that supports their development. This is the provision of intentional basic and developmental care, where their physical, emotional, spiritual, cognitive, and social development is protected. So child and youth care workers in their practice must demonstrate their capacity to provide basic caring for children. And they need to be able to demonstrate that this caring is holistic, and they needing to be able to ensure that the individual care for the child is considered as well. Some of the training competencies here is showing an understanding of the rationale behind care routines for the supporting and encouragement of the development and protection of children. So ordinary care routines are critical for the implementation of child and youth care, caring. Again, if I could just demonstrate this in two more pictures. Here the childcare worker is what you might think reading with the children and teaching them how to read. But at the same time, I think the book that she's reading to them is all about HIV and AIDS, and she's making an opportunity to create a chance for them to understand what had happened to their parents and how it is important for them to protect themselves. But most importantly in the slide is the emotional context. The child and youth care worker is engaging with the children. She is present, she's connecting with them, and they are close with her, and they're experiencing the touch and the care that goes with a task like reading. This is just another picture of how important it is for children to feel childcare workers connected to them, engaged with them, touching them. And here a childcare worker helps a young person get ready for school and actually helps her with the little task of putting on a tie that is difficult for her to do. But in this moment, she's not just putting on and assisting the young person with the tie. She's talking to her, she's connecting with her, and she's showing her that she really cares, that she actually reflects herself well when she goes to school. So, child and youth care workers at para-auxiliary level must be employed and deployed in a supportive context. They don't only support the execution of basic tasks. In the process of these tasks, they can provide therapeutic opportunities and experiences right within the life space of children. So in a way, child and youth care tasks provide an expanded world of therapeutic opportunity. And this is something we feel is often missed, that opportunities to engage with children moment by moment in a therapeutic way through the ordinary daily life events is something that is missed, but is something that child and youth care workers are taught to do. So child and youth care workers connect with children and build relationships with them using ordinary human interaction as a context and as a means for transcending basic care to meet the emotional needs of children. So, now that we're coming more or less to the end of our presentation, I think the question is, how can we share promising practices and overcome challenges in deploying paraprofessionals? We want to suggest that you could use the Global Alliance as a resource. This is where you can get information and where you can network with a range of other people who are interested in the same focus as you are. You could share your ideas amongst the Alliance members through webinars, blog posting, and interest. As you can see, the Global Alliance is interested in seeing that there is a diverse perspectives on the issues that are raised. You could use the information to advocate with government and civil society organizations to utilize para-professionals in appropriate roles contextualized within their community. You could establish guidelines for paraprofessional functions, competencies, and expectation. We hope to do a future webinar on this. We need to recognize that paraprofessional practice is the first step on the career ladder to professional credentials, and that a paraprofessional moving on to education or a higher level job is a successful outcome. We also need to collaborate with professional schools on curriculum, certification, managing infrastructure, social work, community work, child and youth care work are 3 examples of professions that we are talking about. We need to include paraprofessionals as associate members in professional associations so that they feel a sense of identity and connectedness. We need to network with other countries who have developed policy and legislative frameworks to include paraprofessionals in their workforce planning. And this is where we can actually look at policies, look at approaches that would make it easy for us to do it in our own context and in our own countries. And so the way forward for the parasocial service worker interest group, we are looking forward to receiving and incorporating the feedback and input from this IFPCAN Manila conference into the documents that are presented. And I think that you have I am sure, a lot of ideas and perspectives that would be of relevance to the development and finalizing of the documents we have presented. We're needing to look at promoting the guiding principles and the planning and the development and in the supporting of parasocial service workers globally. We have agreed at our interest group meeting to field test and finalize the generic core functions, practice and training competencies, the ones that Nathan presented. And then we wish to publish the principles, the functions and competencies in both web-based and in written format. We're also looking at finalizing the functions, practice and training competencies for child and youth care workers, the ones that I presented. And we're wanting to engage the community development workers and maybe parasocial workers and other groups in developing or finalizing their own functions, practice and training competencies. I think this is a true recognition that in the social service sector there are various professionals that need to be developed to holistically constitute the social service workforce. We also want to document the finalized guiding principles and the generic core competencies and the child and youth care workers competencies. And we're hoping to present the child and youth care competencies at the Child and Youth Care Conference in South Africa in July in 2014. And this is an invitation for anybody at this conference here in Manila who would like to actually come to South Africa to feel free to make arrangements to do so, because you are very welcome. We also would need to reassess the principles, the functions and competencies, and if needed, prepare a second edition of these materials for further use. And so from Nathan and I think that we would like to say thank you very much for listening to us and sharing this platform and this presentation with us. Thank you.
Thank you very much, Zeni, and thank you, Nathan. There is a lot of material in this, and there's been an extensive amount of work done on this in this area, very important area. A couple of things. One, I noticed somebody asked, is it possible to get the presentation? And Alex is going to type in the answer, but yes, it will be possible to get this because there is so much information. I'm sure many people would want it. And then what we've got here is about 10 minutes for any kind of questions to Nathan and Zeni while we still have them online. So I think I will start off with a question. If any of you online have any questions, you can write them in the chat box. And if Nathan's microphone is working or Zeni's microphone is working, they could answer the question. If not, they could also type into the chat box. So the question I had is a clarification question, perhaps, and you may not have gotten there yet, Nathan and Zeni, but in the way forward, you were talking about field testing the functional areas and the practice competencies and the training competencies. And I was wondering what that field testing might look like. What would you do in that to get that out in the field and to field test it? Nathan, looks like your mic is working. You want to give that a try? I can't hear Nathan at this point. Yes, I think we're just having a little trouble with our microphones from Nathan and Zenny. Perhaps you could type in, and I see Zenny is doing in response to the question about field testing. It's possibly identifying a community in a specific country and pilot the competencies there. And Nathan said, so we're just at the beginning to get to the field testing phase. I think the first step would be to share the competencies with a group of paraprofessionals and then try to get them to implement that accordingly. So if I could sum up, I mean, so far the competencies have been developed through a network of 20 or 25 or so people in the field, but not necessarily with paraprofessionals directly. So this would be one way to do the field testing. I see that there are other people typing. That may have answered that question. Bernadette, and I see Nathan added in there that we can use direct feedback from paraprofessionals as well as supervisors. That will be, kind of sort of field testing and ground truthing. This would be very helpful. Bernadette, you might want to ask if the panelists have any questions at this point for either Nathan or Zenny, and they can write their responses in the field, and I could go ahead and use them. While Bernadette is getting ready to do that, Ron did type in a question which says, one of the guiding principles is to retain localized paraprofessional social service workers. On the other hand, another principle states that would require access to a career ladder, which potentially would take them away from their communities. How do you balance those two principles? Good question. Maybe I see Zenny was typing, but either Zenny or Nathan could type in an answer there. And Zenny typed in and said to retain them does not should not limit their ongoing development. Even though I'm assuming, even though that may mean they might leave the community they're in. Nathan had typed in, it's a great question, and this is a concern. In fact, when a paraprofessional moves to achieve more education or another related position, we see it as a success. Zenny was said it's not an either or, but a both and approach to development. And the specific program needs to determine objectives. If the goal is to continue with workers in their community, this can be set up to stress that accordingly. And in South Africa, as Zenny said, we are retaining them as developed and developing in their own communities. So, but again, a good question. There's a dynamic balance that's to be worked out there in the future, probably depending on local context. Okay, Bernadette, you said the panelists were ready to go, ready to share their comments. Do you want to go ahead and do that? Is your microphone working? I'm not hearing any sound.
So I would like to share my thoughts.
Yes, I think your mic was off and your sound is a little down.
The sound is down. Okay na. Try again.
Okay. Good afternoon. Do you hear me?
Yes, that's very good.
Okay. Thank you once again. Thank you very much for your presentation. I'm Gemma Gabuya. I'm working from the government, in particular the Department of Social Welfare and Development. And I would like to, I'm happy to share with you my thoughts on the model that you have shared to us. First, I noted that you have mentioned that paraprofessional social service is broadly defined, and there is no recognized definition at the global or regional level. And I think I agree on this because even at the country level, we have not yet defined what is paraprofessional and social service. However, I see the opportunity to advocate this concern at the ASEAN sub-regional bodies, considering that our country is representing the senior officials meeting on social welfare and development, and one of the major goals at the ASEAN level is to strengthen social case management at the ASEAN level, looking into the vulnerable groups, including the children, the persons with disabilities, and the older persons. That's my first comment. And second, I also believe that training is a very important part when it comes to paraprofessionals, and I'm interested to know if how long is the training being conducted, and is it ladderized? Is it something, for example, Child Protection 101, and the next level is another level of competency. So, because this really requires a lot of resources in terms of training our paraprofessionals. And third, I want further to know about the career ladder for social welfare system. This is something that we can explore at the country level because currently we have a lot of paraprofessionals, but we call them as volunteers. And both in our community social welfare services and center-based social welfare services, particularly for children. And noting the overarching principles, we share the same, no? And in terms of recognizing the strengths-based, culturally sensitive, these are the things we also observe in our work with our children. And you identified some elements in institutionalizing paraprofessionals, such as planning, the development of paraprofessionals, and what is important, I noted the support that should be given to the caregiver. So you said there's a need to compensate or to provide remuneration, and I think it's one of the challenges here in the Philippines when it comes to really sustaining our volunteers, especially in our poor municipalities, who can't really afford to provide this kind of incentives. It's good for our first, second class or cities or municipalities. And then in the competencies, yes, I agree, communication is very important, and the skills in terms of understanding really the rights of our children, the what are the basic knowledge, attitudes, and skills that is required for our paraprofessionals. And I think this really, again, requires a long process of developing our paraprofessionals. So in the Philippines, we have some good practices, but again, the problem is we have not documented it yet. Maybe it's one of the things that we would like to explore. We have, for example, for the DSWD, we have our volunteer intervention program for the youth, particularly for the children in conflict with the law, which is a very specialized program. And this is very challenging. But again, this has been devolved or transferred to our local government units. And again, that's another challenge. So our volunteers assist the social workers, for example, in the case management processes, such as the conduct of home visits, school visits, even attending court hearings. That's part of the work of our volunteers. And we have also parent volunteers in our community because of the our program on parent effectiveness service that also, again, implemented at the local level. And then we have our daycare service. I understand they are also paraprofessionals because they work on a volunteer basis, no, but they're not part of the plantilla. These are good work interventions in terms of the Department of Social Welfare and Development. So paraprofessionals in the Philippines is really one thing, no, and a priority, and I would say because of its devolution of the basic services. And second, the new phase of poverty, which is multidimensional, which is not only relates to economic, but it relates to other aspects such as health, education, and even the standard of living of the people. So again, thank you very much. I appreciate it very much, and this is a good venue where we can explore and we can enhance our current practices when it comes to volunteers or paraprofessionals. Thank you very much.
Jim, do you think that Zenny or Nathan will still be able to comment on some of the issues brought up by Gemma? Like, I see here that Zenny typed that the training for the child and youth care workers is both at the under 1 year training, and they also have a 2 years training which is accredited. So is this something that South Africa developed, this, if just a little expansion on this bottoms up development of workers at 2 levels? Just those sounds.
It looks like it to me, Bernadette, and I think Zenny is typing something else, and it says, yeah, yes, she does have, they do have an accredited training, and Nathan's microphone looked like it was working, but I'm not sure. Nathan, are you, is your mic working?
I don't know.
Yes,
can you hear me?
I can, yes, indeed.
That's wonderful. That's wonderful.
Yeah, we can hear you, Nathan.
So, great. So my comment would be that there really are sort of elements that transcend all of the places where we've tried this approach, and there are other places where it evolves differently. So I think that's what we really meant when we were talking about the generic competencies versus the more specialized ones. It's trying to aim for enough flexibility so it'll be useful in different locations. So as far as training and supervision go, the important thing to remember is that these are paraprofessionals and they're not credentialed to practice in any kind of independent level. But they may be in places where they don't have the kind of supervision and support we'd like, but we still have to develop ways for that to occur. And so training becomes important both as an incentive and as a way of a sort of doing some quality control. But the issue is, and it was raised earlier, that when you offer people training of this type, then they begin to get the idea that they can be trained and move on to other things. So it's constantly a sense of how do we provide sufficient incentives to keep people to do the job for a sufficient period of time versus how do you move people along and give them succeeding roles and help develop leadership within the social welfare system. And one way that this has been dealt with is by establishing an agreement from the beginning that the paraprofessional is going to work for a given period of time in a location, like 1 year or 2 years. And then they graduate from that program and move on to other roles if they're successful. So those are some of the ways that we've been able to address some of those issues.
That's very helpful, Nathan. Yeah, we got that. And we could see that Zenitype, that there is a commitment in South Africa to develop various professionals bottom up, from volunteers to social service workers. So I guess in South Africa, there's also an agreement. Like in the Philippines, for example, there's some institutions who would, in a sense, send you for scholarships that in exchange for 1 year, you give 2-year service. But I think part of the problem that Gemma mentioned earlier is that compensation or salaries, you know, or incentives to continue at the post may be lacking. While Zen is typing, I'll give the microphone to Dr. Ines Danao.
I'm Ines Danao of Asian Social Institute. Asian Social Institute is a graduate school for social work, sociology, economics, education, and applied cosmic anthropology. Good afternoon, colleagues in the field of child protection. Every first-time experience is thrilling. This is my first time in international e-conferencing. This conference, we may say, is conference without borders. It crosses time and space at the least cost. So webinar, thank you. I will date myself as I tell you that I was in the senior year of my Master of Science in Social Work when paraprofessionals in social work was a hype in the Philippines and was a global trend. Interest in it waned, but paramedical and paralegal capacity building stayed on. I remember the production of indigenous instructional materials, sharing of these materials in international conferences, and ladderized Bachelor of Science in Social Work curriculum akin to what was presented as career ladder for the social welfare system. To date, the term paraprofessional was replaced with peer counselors or peer helpers, community leaders or eco-warriors. The Society of Filipino Family Therapists, of whom Ophel and I are involved in, have the so-called Barangay Family Network. I wonder how many of those schools of social work with ladderized DSSW curriculum in the 70s and the 80s sustained this program. I am curious, when did the Global Social Service Workforce Alliance start the webinar, and how many of its member countries have career ladder program, as well as how webinar works. What I like most about the paper presented are the conceptual and operational framework. Our professional credentialing has clear terms for training and evaluation of practice competencies. In the Philippine tertiary education, we have shifted from competency-based to outcome-based education to further enhance the learner-focused education. To facilitate the transfer of technology, I would like to request the Global Social Service Workforce Alliance to continue with the webinar and extend to other training institutions, as well as share the following resources. 1, the career ladder curriculum. 2, performance evaluation tool and system. Third, this was mentioned already by Gemma, documentation tool that supports evidence-based advocacy. Documentation tool or system that support development of practice models. And how is accreditation conducted? Is it in-house or interagency? What is the system?
Did you get that, Nathan and Zenny? You know, I think that Dr. Danao brought up some very valid comments. Well, first of all, she likes the webinar. I'm sure she's now going to be a member because I'm going to insist. Okay? And, but there are some, I think, you know, this communication between the different countries and whether they have paraprofessional programs, you know, would really be helped by the webinars and the sharing of tools in terms of accreditation or in-house or external or evaluation. Would you like to make some comments on that?
So this is Nathan, and I really appreciate your points. Particularly interesting is your sort of historical view of how paraprofessional as a trend has come and gone. And there certainly have been parallels to that both in the U.S. and in some of the other countries that we've worked with. Also, the term volunteer is a very interesting term that was mentioned earlier because it really has a different cultural meaning in different places. And in some places, there's a whole history of volunteers having a lot of status in the community. In other places, it's sort of a way of obligating people. So language and culture are really important when you talk about these concepts, and sometimes we get in trouble talking across countries about these same ideas and concepts. And also some of the ideas that you brought forward are way ahead of where we are at this point. I think our attempt to develop functions and competencies is going in the direction of eventually helping various countries to certify paraprofessionals. And there is a whole question of what it means to certify a paraprofessional who basically has 1 or 2 years or even less training. So that's another issue that we need to deal with. And finally, I think it's important that we let you know that our interest group is open to everybody. If you would like to join us, you can certainly do that by going to the Alliance website. I think we're getting a lot of echo here. If you go to the Alliance website and join the Alliance and then click the Get Involved tab, you can join either of the interest groups that way.
Hello.
Hello, is that you, Zenny?
Hello, am I connected? Yes, I think I am actually connected.
You are.
Yes. Could I just respond to one comment made? I'm sorry, I missed some of it. And that was about the outcomes-based education, which is actually something that we are using in South Africa, which is wonderful because it allows for the incremental development of workers course by course till they reach the particular qualification that allows them to move into another qualification. And it allows, again, for the development of the parasocial service worker bottoms up. I just thought to make that comment because I heard the last speaker talk about the outcomes-based approach in the Philippines.
And from the last speaker, when she was talking about sharing ideas around career ladders and documentation that supports evidence-based advocacy and so on, those are very good ideas. And certainly that is kind of our intent as an alliance. And I would echo what Nathan said earlier and what Bernadette said, that we would encourage people there to join the alliance and to participate in this, because that sharing, inter-country sharing, can be very, very valuable and rich.
Great, Jim. I'm now giving the microphone to Ophel, the last reactor in our panel.
Good afternoon. I'm Ofelia Mendoza, a social worker, also a former professor at the Philippine Women's University College of Social Work. I really love your presentation because we can see that paraprofessionals are very effective not only in the Philippines, but as well as in other countries. What really caught my attention was the functions and competencies of paraprofessionals along the fields of communication, work with children, all these items here, because this is exactly what we have. These are the skills that we develop in our beginning family networkers. These are non-professionals who are trained to help children or families having conflict and helping the professionals to monitor and to refer or identify the issues in the community, to cooperate with the local authorities and really help them overcome the issue. This is a very good program that we developed in partnership with other organizations. This is developed by the NGOs, and this is happening in different parts of the country. Secondly, the Philippine Women's University students have identified the issues in the community and using and trained the paraprofessionals in addressing the different issues of children. Like, for example, the children in conflict with the law, children experiencing different kinds of abuses within the family. And we also trained the daycare teachers, who can be called paraprofessionals, in addressing the issues of children in the school, reflecting the issues within the family. So they realized that they could also be performing some activities of the social workers if they will be given more skills, especially in communicating with children and families. I love that. However, the most interesting experience that I had using paraprofessionals was when I was assigned to work as project head in Vietnam. There were no trained social workers at the time. That was in the early part of 2000, late part of 1990s. There were no social workers doing social work or helping children in Vietnam. So we developed the program. We opened different programs in different provinces utilizing paraprofessionals. We trained them as social workers, doing all the works of the social work, and they did it very well. The program is still existing up to now, and this is funded by USAID in the US. So I believe that paraprofessionals could really be, if they are trained, could really be equally equipped and effective like other professionals like social workers. So I really admire the work that you have been doing, and hopefully we can help each other in promoting the use or the engagement of paraprofessionals. And we continue, I hope we continue to do that in the Philippines, both in government, non-government, as well as educational institutions.
There you go, Jim and Nathan and Zenny. So there seems to be a lot of work that needs to be done. So far, if I may summarize, everyone is in agreement that paraprofessionals in social work are needed. Number two, if they are trained, they are very effective. And that countries need to share what they're doing in terms of like maybe what South Africa is doing in terms of their ladderized or latticed curriculum. Gemma has a question. I'm going to give the mic to her.
I just would like to ask to the whole process of developing paraprofessionals, how much does it cost?
Did you hear that? Gemma is asking how much does it cost to develop the training of paraprofessionals. Is that expensive?
Okay. Can I respond? This is Zenny. just to say that in South Africa, the accredited training is a 2-year course. And obviously, I'm not too sure how to translate that into the appropriate costing for the Philippines or even in dollars. But it is a cost-effective training because it is provided to the child and youth care workers directly where they are. So if you go to communities where you recruit parasocial service workers to be trained, and you train them in their communities, which is what one of the principles talks about, you actually save on a lot of costs. You train them in local community halls. You send a trainer out there, so you're traveling one person into maybe a remote area than others. And then the accredited training in South Africa, I think Kathy will help me, she's on the line, is approximately, I think, 8,000 South African rands for an entire course, which takes place over about 2 years.
Seni, 8,000 South African dollars for the 2 years. Just a clarification.
Yes, and it's an accredited training, which means that the training is accepted by government as the Department of Education as an acceptable training for recognition. And we are working and talking a lot in some of those principles about recognition. So it is government approved training.
I would say that the cost really would vary depending on how the program is constructed. We don't really have a global standard on that at this point. But there really has been a push in some programs to keep the training periods limited, but we've also more or less come up with an agreement that if a training doesn't include at least 6 months to a year of training, then it's insufficient. And certainly that has been the case with the programs that I've been involved with in several countries. So sometimes it's continuous training for like in a classroom setting with a field component that might go over a period of 6 to 9 months. Other times people come in for initial training, which is what we did in the example I gave in Tanzania, for a couple of weeks. Then they go out and work in a field setting under a supervisor, so they're actually providing services while they're getting the field training like an internship. And that can go on for 3 to 6 months. Then they come back for a refresher training, and after all of that, they are considered a trained parasocial worker in this case. But I think the important point is that you have to design your training with some consideration of what costs are there and also what training resources are there and what will make sense in terms of having an accountable and quality program.
Yes. Can I just support Nathan there to say as well that if the training is incremental, if you start where the learner is, and if they require short courses to build up their confidence and their capacity to learn further, then that should be provided exactly like Nathan says, in that appropriate way, where a little bit of theoretical understanding must be mixed with some practice. So they would go out and practice what they've learned, come back and learn a little bit more, and that approach to adult learning is extremely useful.
If I could, this is Jim again, if I could just add, I think that's a really important question, the whole issue of cost. And that's one that needs a lot of work as we move into the future. And both Seni and Nathan were talking about training costs, and I see some comments in this chat room about that too. There are also costs, if you look, programmatic costs around supporting paraprofessionals once they're in their communities and doing their work, and that support might take the form of some supervision, of some ways to ensure appropriate referrals when they've reached the end of their sort of scope competencies, and so on. And so looking at the cost of a program overall is a really good thing to do. Sometimes it will be more costly than one thinks originally, but the value you get for it is kind of services being delivered in communities that often don't have any services. So it's a very kind of a balance between the costs and the benefits for that.
Supported. And just, Jim, just to add that I think the advantage of being part of the Global Alliance creates a network of opportunities for us to share material developed, to share ideas, and to network with each other so that we actually can make it easier for others who are interested in similar areas of focus to find partnerships.
Right. I think my comment earlier wasn't clear because of some other competing noise, that our interest group would be open to anyone who is in the field and is interested. And it would be great to have somebody from the Philippines join our interest group.
Yes. So Bernadette will have forums.
So I hope Bernadette can help you understand how to join the Alliance and then how to select the Get Involved tab so you can get involved in the things that we're doing.
Yes, we have very interested members here now who will join the Alliance and the interest group.
Yes.
So even just for that, this webinar is worth it.
We agree.
Yeah. We're trying to ask the general audience if there are any questions from the floor. Anyone else? Yes, please. We'll try this now. Someone from the audience will use the microphone from the floor, so we'll see if you can hear it. State your name.
Good afternoon. My name is Steve Caloy Ranario of Home for the 100th Sheep. And first of all, we would like to thank this group, the Global Alliance, to introduce the para social workers, in the Philippines. Though we were doing this in the Philippines for a long, long time, and we named them the volunteers.
Yeah.
I'm just so with a little bit of a background. I know I've heard that in the Philippines there is, correct me if I'm wrong, there is an almost extinction of social workers. And this kind of thing is very good, to address the issue. This group, actually, the para-social workers or the volunteers, are the very group, to be encouraged to become social workers or professional social workers in the later years. I'm just wondering if, because like for us, we're a small NGO and we don't even have social workers, but we're doing the work of the social workers in the Philippines. I'm just wondering, the years of our existence and the work that we do, if it could be accredited as part of the requirements for us to become licensed social workers, and also for our para-social workers, so that we don't have to complete. I know there's a set standard to become professional social workers, but I'm just asking, with this kind of ladderized thing, if the years of experience and the work that we did could be accredited as part of the requirements to become, it's just like a jump, to become a professional social worker, since social workers, the professional ones, the licensed ones, are requirements to become, for an NGO to become registered and licensed. So, it will be a good help, a big help also for the small NGOs if this one will become possible. Thank you.
I think that the question, if you hear Nathan, although it's probably something that needs to be answered in country, but maybe you in South Africa, or Nathan, when you had your program in Africa, so the ladderized or lattice approach, they could become a social worker. In the end, be a registered social worker. There is a way to do that in the community, not to go to the university.
Yeah, this is Nathan, and we have, I appreciate the question, and I am concerned about the extinction of social workers. It's an interesting term, and it doesn't happen only in the Philippines. It's a concern elsewhere because social workers sometimes become marginalized as other fields take on various functions. However, I want to make a couple of points. One is we're talking about social service workers that would include other fields such as child and youth care workers, community development workers, and the like. And of course, every country, sometimes within the country, different jurisdictions define those things differently. And there is a focus on how to develop a scheme of service or an official job description on these various levels. And when you get to the point of paraprofessionals, the concern is that you want to give them the tools that they can use to intervene in an effective kind of way, but they need support, incentives, and supervision in order to do so. They don't have the autonomy that a professional social worker would have. And some of the ways that they get motivated is by having this career ladder or this approach where they can move up into different kinds of levels. But then you also have to consider that you're constantly having to feed into the system. So you have to plan for replacement training, not just initial training. So there's a lot that is entailed in trying to get them into these areas. But certainly lots of us as social workers or as other disciplines that are concerned about social services began as paraprofessionals and we moved up one way or another. So we definitely want to encourage that.
Yes. Can I just add, thank you Nathan for that. In South Africa, Bernie, what we're doing is that we're developing social service professionals bottoms up. So we actually take the approach of training and accrediting the auxiliary social worker. We develop the auxiliary child and youth care worker, the auxiliary community development worker, for example, as well as professional degreed child and youth care workers, social workers, and community development workers. So our approach to the development of the social service workforce in South Africa is allowing various different specific professionals to be developed at both auxiliary and at professional level. And we are very excited that just recently, because I think the speaker spoke about licensing, just recently the government has actually licensed child and youth care workers at both auxiliary or para level as well as at professional level as workers in South Africa.
I think, Zenny, to clarify, in South Africa, your child and youth care workers have salaries?
That is the advocacy we have been doing with government to say that child and youth care workers at auxiliary level do require more than a stipend. Originally in South Africa, they pay them a stipend. The stipend is just a small amount, like you would sometimes pay volunteers, which is something they do in South Africa. But by being a recognized profession in South Africa, it is government's responsibility to look at what their salaries would be. Now, I know that this is not always easy in other countries, but I think the issue of stipends or incentives or the compensation for parasocial service workers is something, when we talk about the guiding principles, we felt is significant to highlight.
Okay. Are there any questions from the audience? One of our professors from the academic. Okay. From the academe point of view, if we look at, we have the law, RA 4373, which specifies that you need 1,000 hours of supervised field work. So we cannot accredit an experience that was done before without classroom training, okay, and supervised field work. So what can happen, what can be done is
design a ladderized curriculum. So you look at what are the outcome-based, no, outputs that are needed per subject and break it down into specific
Yes.
functions or skills. So, but you need to design. It has to be customized, you know. It has to be incorporated in the regular curriculum, but designed in such a way that you break down for the paraprofessional skills training.
Right. So this
Okay,
has been
and
a
over to you.
situation in several countries that there are requirements, particularly to get government approval of these programs, whether it's accreditation or it's some other form of recognition. And so that's something that you have to work out. But I think it raises the issue also of how you set up supervision and field experiences and how those are monitored and accounted for. But I assure you that this is something that can be done, and it can be done successfully.
Yes. And I think to add, Nathan, that from the last speaker, the issue is developing almost what you call unit standards, little packages of training that incrementally build on each other, so that actually workers can move forward in their development towards a certificate and then maybe further studying.
Kasi ladderized. Okay. We don't have any questions anymore from the audience. So are there anything else that Nathan, Zenny, or you, Jim, would like to say?
Well, I want to thank everybody. This is Nathan. And also there has been a question about how to get a hold of the actual document, the competencies and the principles. And I think if you get in touch with the Alliance, we'll try to make an effort to get those available to people. And at some point we will have a draft publication that will go into some detail about how this has been put together and how it can be used. But that's still a work in progress. That's one of the things the interest group is working on. So thank you very much, everybody.
And can I as well say thank you very much. It has been extremely inspiring to be part of this webinar with all the technical difficulties, but it seems like I think the interest in parasocial service workers and the work that we've done is so exciting. If I could just actually say that from South Africa and from the childcare perspective, is that we are aware globally that in Africa by the end of the century, half of the world's children will come from Africa. And we are concerned that we make every effort to develop child-focused professionals that are actually relevant for the needs of children in Africa. So our interest in the child and youth care competencies has a very important passion for us. Thank you. Thank you very much, Bernie and the team.
And I wanted to thank everybody also. I agree with both Nathan and Zenny about this finding this both really useful and inspirational. The subject matter is very important for all of us, and I think that the kind of interchange with, in this case, with the Philippines and with some of the people from different countries online has been very useful, and we encourage kind of accessing the website so that we can continue this kind of exchange. And thank you to Bernadette and your colleagues for making this happen, and for the panelists for, I thought, some very, very thoughtful remarks. This has been very useful. Thank you.